Welcome to Orange County Power Players, where we spotlight the personal, professional, and financial success stories of OC's top leaders. Here's your host, Danny Flores.
Welcome back to OC Power Players, where I interview some of the most successful people in Orange County. I'm your host, Danny Flores, and today's honored guest is Dr. Sailaja Golla, zooming in from Irvine. Dr. Golla is a board-certified neurologist and neurodevelopmentalist with national and international expertise in the field of autism. She currently practices at the Thompson Autism and Neurodevelopmental Center at Chalk. She is the director of the Fragile 10 Clinic at Thompson Autism and Neurodevelopmental Center, associate professor at UC Irvine School of Medicine and Research. Welcome, Dr. Golla.
Thank you. Thank you, Danny. Thanks for having me here on the show. Appreciate it. Thank you.
So tell us a little bit about what you do, Dr. Golla.
I am a pediatric neurologist, so I treat children with brain disorders, particularly interested in the field of autism and developmental delays in children. In addition, I also take care of pediatric neurological conditions such as seizures, headaches, ADHD, learning difficulties, strokes in children. So kid specialist, 0 to 21 years of age is my specialty.
So how long did it take, or how did you know, and how were you drawn into this specialization as a physician?
The concept of mind and treating children with any neurological condition always fascinated me as a child. I strongly feel that if the brain can be molded at a very young age, there is something called as neuroplasticity, which kind of works better in very young children. Just to give an example, the recovery rate of stroke in a child is very high, but when we see an adult with stroke, I think sometimes they're kind of paralyzed for life. The recovery rate is low, and I'm always fascinated that if something could be done at a very early age, then of course that would yield a better treatment. Early intervention is very important. So that led to my interest in the field of autism and developmental delays like speech delay, walking difficulties, talking difficulties, or learning difficulties. So I could help these young children at a very young age to make a life better for them.
Right. Now, is there, how do you make your program known? Meaning somebody, a family that might have or might be questioning their children, whether they have it or not. How do they find out about that?
Typically, they go to their pediatrician for a regular visit, whether it be vaccines or a regular pediatrician visit. If the pediatrician, based on their checklist and the clinical visit, identifies any developmental delays, such as red flags for autism, the child is not talking or having poor social skills or any other challenging behaviors, they refer them to a specialist, such as me, a neurologist, or a developmental pediatrician, or a psychologist, and then additional testing are done.
Yes, and so are there a lot of children that struggle with this?
Yes, currently, as per the recent census, it's about 1 in 60 children have autism, and it's much more common in boys. It's about 1 in 40 boys have autism spectrum disorder, which is really alarming, because is it actually the autism, or is it just that parents and teachers and healthcare providers are more aware, or is there something going on in the environment? So it's been interesting.
What causes that?
So autism, 20% of the time there could be a genetic cause. Hence, we always do genetic testing. At least I do genetic testing in the clinic when they come in for an evaluation of autism. 70 to 80% of the time there is an unknown cause. But also there are children, say for example, premature children, or if there is a birth injury or maternal drug abuse or alcohol abuse or something concerning in the family. There are other causes of autism too, but most of the time it's an unknown cause.
Wow, that's interesting that you kind of don't know, right? And you don't know when they're born whether they're autistic or not.
That's right, and that's challenging, especially from a parent perspective. And if they're new parents who are not aware of autism, it's such a challenge. So the family needs a lot of support as well, and a lot of commitment too.
Right? Because the family needs to learn how to help their children at home as well. Is that correct?
That's correct.
So how does a family, I mean, you take care of the children, but who teaches the family how to cohabitate and how to help improve the living conditions or improve the children's conditions at home?
There are a lot of services offered to families and parents of children with autism. At our center, we have a mom's meetup group once a month where they meet for coffee and breakfast, kind of get that psychological support and emotional support from other parents whose children are affected with autism as well. In addition, there's family therapy, psychological therapy, and there are funds as well financially provided from philanthropic and other resources to help these families with challenging condition. And of course, your doctor, regular pediatrician, in addition to a neurologist and a psychologist are always available for additional support to families. And it's quite a huge burden to the families, especially if both the parents are working. Then one parent probably has to take some time off or put in that
Right.
extra effort for commitment.
Yes, yes. I mean, and it's the children, right? You have to commit to them and have to spend that time getting educated and learning how to deal with them and making, helping them develop, right? At the end of the day, once they grow up, you want them to be productive and hopefully they can assimilate into society at the same time and live a regular life. Now, as a family is evaluating which doctor they're going to go to, what does your methodologies, how do they stand out above the rest and make it more attractive to go to you and how you treat the children?
So my area is neurology and development. So I think it helps to manage the child medically, but also if they need additional support, for example, say psychology support, or if the child needs a medication, we offer that. It's like a home for a child, medical home, I would say, medical home for a child with autism. At our center, we also are affiliated with occupational therapists, speech therapists, psychologists, and other physicians such as gastroenterologists or dentists who can also alongside see the children with us so they can get that additional expertise as well. We offer a multidisciplinary clinic, so just not neurology, but if the child has additional sleep issues or gastrointestinal issues or needing a dentist, for example, we can assist with that as well. We also offer school services through our school director who can help them with school placement because the child spends a lot of time at school. And hence we want the child to do well and progress at school as well.
Well, that sounds like now is this like a hospital, what is that like? Because you just mentioned so many things that you provide. It's like if the family goes to you, they have everything that they need for the children and for the family. So is that like a hospital, or is it kind of a combination hospital school, or what is it like?
So it is an outpatient clinic affiliated with the Hugh Children's Hospital. We are part of a huge hospital. We are just located a couple of blocks from the main hospital. So we are closely associated with the Hugh Children's Hospital lab. If the child needs additional testing or a seizure study or a picture of the brain, we can send them over to the main hospital, which is a couple of blocks away. At our center, we do genetic testing. So basically, it is an outpatient center, which is kind of a little detached from the hospital, but we are part of the hospital system.
Okay. Now, if a parents, because usually it's both that's hopefully get involved with the children, and they need to learn and seek out additional help. What would be the best way for them to do that so they learn how to help their children?
So they come in for an initial visit, and we kind of make a checklist of other things they might need. For example, we have a social worker and a resource coordinator within our clinic who can help them with other resources. For example, a parent needs transportation and is not able to afford, or needs some other kind of emotional support, or doesn't know how to get the child admitted at school for special needs services. We do have all those resources. We have a huge team of medical assistants, nurses, psychologists, therapists, behavior therapists, social workers, and additional staff who can assist, serve not just the child, but the whole family. And we have them come back periodically and visit us every 4 to 6 months or once a year based on their needs to make sure it's met and they're well served.
No, very good. That's good. That's good to know because you don't know what they need, and maybe they don't know what they need or what's available. So that's great. There's so many different services available for the family and for the children. Now, as you developed and you specialized in this, what was your biggest challenges that you had to overcome as you specialized in with the children and autism?
I think it's challenging, but at the same time, at the end of the day, you get that satisfaction, both personally and career-wise, that you are trying to make a difference in the lives of these children who need the most help. And sometimes it's just the satisfaction, not just working for a job, but also trying to make an impact on the society as well. To talk about the challenges, yes, of course, starting from getting into medical school, taking all these extensive exams, working overnight, taking calls every third day. It was quite challenging. There were a lot of times when I decided, oh, I quit. I can't take this. It's quite challenging. Do I want to do this? It's affecting me personally, but I think at the end of the day, I feel a sense of satisfaction and that feeling of happiness that yes, all the years, I think to get into this training particularly, I had to go through a lot of medical school, 7 years of additional training. So it's almost an additional 17 to 20 years of training after your high school. So it's quite a lot. But again, at the end of the day, you feel really good to get such great training and mentorship and do something for the society and these children with neurological disorders.
Wow, that's quite a commitment to be able to all those years of education to be able to accomplish what you wanted to do, and then to be able to help the children. So congratulations on that. It looks like it's going well for you.
Thank you, Danny.
Now, many times physicians, uh, they look for outside investments, particularly to try to potentially set themselves up for retirement over a long period by making passive investments that won't take time from their busy schedule and what they're doing. What are your thoughts on that?
I think it's good. Investment is always good from a personal perspective, but also, of course, you have your own family and things to take care about. And investment is always good. It depends on what kind of investment. So, in terms of medically or work-wise, I think I think one day there will be a treatment for autism. As of today, there is no treatment. My goal or vision would be to invest in building an autism center where it's a to-go place for all these children who could get care from all levels of the society, whether it be they cannot afford or they can afford and make a lot of donations. A lot of our families even donate.
Right.
For example, our center, I think we do get a lot of philanthropic donations, so that helps. So yes, I think investment in mental health disorders, both personally and any state funding and federal funding would definitely help, especially because mental health disorders does not show up physically like a heart issue or chest pain or asthma. It's different. It's something a lot of people suffer, whether it be children or adults, and there's a lot of help needed there.
Right. No, those are great dreams to have, and hopefully one day over time you're able to do that and make that reality. That would be awesome. So as we wrap up our interview, what does 2025 look like for you?
That's a great question. I think with the changing political scenario of the country, I think I would still be hopeful and optimistic. Being optimistic is always good, but at the same time, be prepared for challenges. I think 2025 would probably definitely add some impact to mental health, especially towards the mental health and neurological care of these children affected with neurological disorders such as autism. Hopefully, there's more research as well. There is advent of gene therapies and a lot of new therapies for these rare neurological disorders and autism in particular. So I'm hoping to see a positive change, especially in the field of autism, both in the diagnosis and treatment aspects.
Well, thanks so much for all the insight you've provided us, Dr. Goya. If somebody is listening and wants to get a hold of you, how could they do that?
Definitely, I would like to share my information. I work at Thompson Autism and Neurological Disabilities Center at Children's Hospital of Orange County. And of course, you can pull me up by the name, and there's all the contact information there. For our clinic specifically, you need a referral from a pediatrician because we would like to know that this is the right place to be seen. And our front desk coordinators will definitely assist with the rest of the paperwork if need to be seen in a clinic here at the Autism Center.
Wow, thanks so much, Dr. Goya. And to our guests, please go to ocpowerplayers.com and follow us on your favorite channel. And don't forget to like us. Thanks so much, Dr. Goya.
Thank you, Danny. You have a good day. Thanks. Bye.
Thanks.
Thanks for listening to Orange County Power Players. Want to share your success story? Apply to be a guest at ocpowerplayers.com/guest.